A common question we get here at Advanced Health is, why do I keep having this recurrence of low back pain? Why does it keep coming back? And it comes down to how you address the problem, and if you're addressing the root cause instead of the symptoms of the problem. And what I'm getting at here is you have to address three things within the spine to fix the low back pain long term. First thing is the structure of your spine. Has your spine lost a lot of its curve, which is putting a massive amount of stress and tension in the soft tissue in the disc? Have you addressed your joint function? Are all the joints moving in its full range of motion? And lastly, if you address the soft tissue, is the soft tissue allowed to lengthen its full range of motion, and does it support the joint and the spine through range of motion? Also, you have to look at what you're doing away from the office. Do you sit for 8+ hours a day? When you're sitting, are you getting up at least 5 minutes every hour? Are you moving around, do some at-office stretches or some core work? Do you have a stand-up desk? Or is your job role involve a lot of repetitive stress, particularly lifting? Do you have good lifting techniques? Are you bending through your knees? Are you wearing a brace to support your lower back? Unfortunately, it takes years for the spine and the tissue to break down, and low back pain is just years of this compensation, essentially. However, when we see a lot of patients, expect a home run. Unfortunately, conservative care, there isn't a home run. It's not a one and done. You have to address three things: the alignment of the spine, the function of the joint, and the integrity of the soft tissue. So if we're not doing all those three things, you're going to see relief, but based on your symptoms and or the environment that you're working in, the low back pain has a very good chance of coming back. Imagine your spine and your spinal health like your teeth. You brush your teeth twice a day, every day, because when you go for your yearly dental checkup, you go because you don't want cavities. And when you don't have cavities, great, you go away and you keep brushing your teeth. The spine's the same. If your spine's in alignment, your joints are moving, and the soft tissue, muscle links and tendons are allowed to lengthen in the full range of motion and are stable, chances are, unless you're suffering some unfortunate event like a trauma, you're not going to have low back pain, and you're not going to have a recurrence of the low back pain. And that's what we specialise in at Advanced Health, tuning the root cause. We evaluate your spine and its alignment, the joint function specifically in the area affected, and obviously we address the soft tissue. So if you're sitting there with low back pain or recurrence of low back pain, a family member, a co-worker, a friend keeps having low back pain, I encourage them to get their spine alignment checked out, check for their joint function, and addressing their soft tissue. You can share, tag any family member or friend, co-worker that you think could benefit from this video, and we'll see you at the next one.